This presentation is to introduce auricular therapy. Sometimes it is called auricular therapy or ear reflexology. Auricular therapy is a healthcare procedure in which stimulation of the auricle of the external ear is utilized to alleviate disorders in other parts of the body. Depending on what type of stimulation method is used, it can be subdivided into ear acupuncture, electroauricular therapy, ear acupressure, and earring therapy. Since the most reflexology is based on the stimulation of sensory nerves, a brief overview of the nervous system will be helpful to understand reflexology. This presentation is made of 3 parts. Part 1 is a brief introduction of the nervous system. Part 2 explores treatment options in relationship to nerve stimulation. Part 3 explains acupuncture and ear reflexology. The human nervous system is a highly specialized network that contains billions of nerve cells called neurons and is responsible for controlling and coordinating all the functions of a body. It consists of 2 major components, the central nervous system and the peripheral nervous system. The central nervous system consists of the brain and spinal cord. It coordinates the activity of the entire nervous system. The nervous system, which is outside the central nervous system, is called peripheral nervous system, and it connects the limbs and organs to the central nervous system. The peripheral nervous system consists of the somatic, autonomic, and cranial nervous systems. The somatic nervous system consists of sensory nerves and motor nerves. It controls the voluntary movements of our body and helps us feel through all our senses. The autonomic nervous system controls functions that are normally below the level of conscious mind, which includes functions of internal organs. The autonomic nervous system is divided into the sympathetic and parasympathetic nervous systems. Sympathetic nerves trigger a fight or flight response. Parasympathetic nerves trigger a rest and digest response. The nervous system embedded in the linings of the gastrointestinal tract is called the enteric nervous system. It regulates gastrointestinal functions. Cranial nerves are nerves that emerge directly from the brain. They do not pass through the spinal cord. There are 12 pairs of cranial nerves. They control sensory and motor functions of the head and the face. The 10th cranial nerve is called the vagus nerve, and it controls parasympathetic functions of some abdominal organs. This is a diagram of the autonomic nervous system. The sympathetic nerves exit the spine between the neck and the lower back. The parasympathetic nerves consist of the vagus nerve and the pelvic nerves. The pelvic nerves exit the spine at the level of the pelvis. This picture shows how the 12 cranial nerves innervate the different organs. In summary, the nervous system is divided into 2 major systems, the central nervous system and the peripheral nervous system. Nerves in the brain and the spinal cord belong to the central nervous system, and the nerves outside the brain and the spinal cord belong to the peripheral nervous system. The peripheral nervous system consists of somatic nervous system, which controls voluntary movements of the body, and the autonomic nervous system, which controls functions below the level of consciousness and regulates internal organ functions. A most fascinating fact is that stimulation of certain parts of the sensory nerves pathway can excite or inhibit the brain function, resulting in physiological responses. These specific parts are called reflex area in reflexology. The center of the nervous system is the brain. The brain monitors and regulates the body's actions and reactions, not only with the nervous system, but also with the endocrine or hormonal system. There are many endocrine glands in the body, and some are located in the brain, such as hypothalamus, pituitary, pineal glands. This picture shows endocrine glands in the body. The endocrine system is made up of a series of glands that produce chemicals called hormones. Hormones regulate various physiological functions, including metabolism, growth and development, tissue functions, and mood. The nervous system and the endocrine system work together to maintain the health of body and the mind. The cerebral cortex can be divided into lobes and areas where different physiological functions are regulated. The cerebral cortex is a sheet of neural tissues that is the outermost layer of the cerebrum of the brain. It plays a key role in memory, attention, perceptual awareness, thought, language, and consciousness, as well as sensory and motor functions. A cortical homunculus is a pictorial representation of the portion of the human brain directly responsible for the movement and exchange of sensory and motor information of the body. This picture helps to visualize the location of the anatomical area corresponding to the different functions in the cerebral cortex. The hormonal glands and the vital neural tissues are located deep inside the brain, so that they can be protected from minor superficial brain injury. Neuroscientists have mapped out the anatomy of the brain and the functionality of each part of the brain. Here is a list of major brain tissues and their functionality. However, we have to remember that all the neural networks are working together to accomplish their functions. Prefrontal cortex is responsible for setting goals, making plans, and shaping emotions. Limbic system, which includes the basal ganglia, hippocampus, amygdala, hypothalamus, and the pituitary gland, is the central station of emotion and motivation. The basal ganglia regulate anxiety and nervousness. The hippocampus is responsible for forming new memories and detecting threats. The thalamus regulates sensory perception and motor functions. The hypothalamus regulates the sympathetic nervous system. The pituitary gland triggers stress hormones and makes endorphins. The amygdala regulates fear, panic, and motivation. The anterior cingulate cortex is responsible for reward, anticipation, decision-making, and attention. The temporal lobe is responsible for memory and anxiety. It seems like we know so much about the brain. However, how can we use this information for clinical application? Since ear reflexology claims that the reflex area of the body and the brain can be located in the auricle, ear reflexology may offer possibility of treating some disorders, which we never thought possible. Here is a list of some treatment options that we can use to treat disorders: drugs and surgery, nerve stimulation with the electric or magnetic pulse, cognitive behavioral therapy, physical therapy, acupuncture, massage, and reflexology. An intervention to the brain by drug is not easy. since the brain is protected from unwanted foreign substances infiltrating from blood vessels. This is called the blood-brain barrier. The blood-brain barrier acts very effectively to protect the brain from many common bacterial infections. The cells that form the barrier allow transportation of metabolic products such as glucose and allow the diffusion of oxygen, carbon dioxide, and some hormones across the barrier. The blood-brain barrier hinders the delivery of therapeutic agents to the brain, so prescription drugs have limitations. As an alternative, non-drug treatment systems have been developed. The stimulation of nerves or brain tissues by electric or magnetic energy is an example. It is not a common treatment method, but it has been practiced with some positive results. Certain procedures are rarely used these days, and some are still commonly used. Here is a list of nerve stimulation systems. Electroconvulsive therapy, electric brain stimulation, deep brain stimulation, transcranial magnetic stimulation, vagus nerve stimulation, spinal cord stimulation, transcutaneous electrical nerve stimulation. The following disorders are sometimes treated with this nerve stimulation technique: acute and chronic pain, depression, migraine, epilepsy, schizophrenia, bipolar disorder. The following pictures show different nerve stimulation treatment. This is a picture of electroconvulsive therapy. Electric brain stimulation, deep brain stimulation, transcranial magnetic stimulation. The objective of these therapies is to regulate brain cells to function normally. Vagus nerve stimulation, spinal cord stimulation, transcutaneous electrical nerve stimulation. This is the first TENS unit called electret, invented by Charles Willie Kent in 1919. This is a modern TENS unit. Medications for psychological disorders hit a very broad range of the body and the brain, and often cause side effects including dry mouth, lethargy, diminished libido, agitation, or suicidal thoughts. Brain stimulation therapies are not without their own side effects, which can range from headache to memory loss. The cognitive behavioral therapy, psychotherapy, and neuroplastic therapy are also effective treatment methods to alter brain functions. Brain function can be modified by rewiring the neural circuits with these therapies. These days, acupuncture, massage, and reflexology are well accepted treatment methods for various disorders. Since the brain regulates the physiological and the cognitive functions, we cannot achieve healing without finding a way to interact with the brain. According to ear reflexology theory, the brain is represented in the ear, and the stimulation of a corresponding point in the ear is believed to have the same effect as directly stimulating the brain.